Good afternoon, everybody. Very happy to see a lot of known faces and a lot of unknown faces around. So I'd like to start with requesting you to just let me know whether you can hear me. Am I audible? Just click on your reaction and do a thumbs up that you hear me. So do you hear me? Okay, great. Excellent, excellent. Very good. So I know there are Bangladeshi colleagues all around the countries from many institutions. And there are our colleagues from outside Bangladesh, from Nepal, India, and also from other countries. They have joined us, and I convey a very warm welcome to all of you. Today's session is an academic one, but it has a very big purpose for the future of your work. Each of you who has participated in this session is willing to become a full-blown researcher, or you're already an established researcher who really want to go up your career ladder. And the topic today is also supporting a conference that we are going to host very proudly, announcing the first National NCD Conference in Bangladesh. So this is the second large conference in Bangladesh, but the first one that is a national stature. So with further ado, I really want to start up with the talk. But before that, let me ask a very quick question. Do you have any question for me before I start? Anyone can open the microphone and just speak just for 1 more minute, and then So the first question would be, why we bother to writing an abstract? So writing an abstract for a conference is really an important start for rapid sharing of new knowledge, because abstract is a short document that can be rapidly shared with a wider group of people, either researchers or non-researchers, even the health professionals who are engaged in health and who are our stakeholders, people like us who are engaged in health research. This research knowledge sharing really help professionals for decision making, the doctors, other researchers, and also the policymakers. So this is a public good, and those who are involved in research, it is an ethical obligation for you to knowledge share, because with your knowledge, there is someone sitting somewhere at some corner of the world who may benefit from your knowledge to apply in their own setting and support their patients or their community for saving lives. But our abstract is a start point of writing a manuscript, and manuscript is a core requirement for building a career ladder. And a scientific manuscript that is published in a peer-reviewed journal is considered a very credible document for refer for policy decision or any other evidence synthesis. And unfortunately, abstract is one of the, or fortunately, I should say, is a small document that is most read by any reader in any form of scientific writings. So there are a lot of professional credibilities. So you may ask, what are the other forms? There are many other forms that we are engaged in scientific writing. You all know about concept notes, writing proposals, grants. You write a lot of thesis and dissertation, either for your academic degrees or for other purposes. Even in research domain, we write a lot of papers. We write reviews, research briefs, policy briefs, and the most difficult part is writing a manuscript. But writing the abstract is the most easiest of all, and we often write abstracts for conference, and we really need to pursue this journey very strongly. So abstract writing is a kind of scientific writing that is used in many purposes, and it is a very structured style of writing that is developed around a standard format. And whole idea is to present your idea or new evidence to certain details that will allow a broader group of researchers to acquire valid evidence and use it for their own benefit. and the results and conclusions are drawn based on facts presented in an abstract, not in an abstract way, but in a very objective way. I think the most difficult thing is how to start writing an abstract. But how do you decide that you want to write an abstract? This is an open question to you all. Just any of you, just open your microphone and tell me, when do you write an abstract? Generally, when you decide that you want to write an abstract? Anyone? Anyone open up your microphone and say it. I'll go by 5. 5, 4, 3.
If there is any conference submission.
Excellent. This is the most common start for writing an abstract. Either we write it from existing research that is already we are dealing with, or we start off writing it once a conference is announced. So there are differences in writing an abstract for a conference and writing an abstract for the manuscript. When you start writing an abstract for a conference, you first need to read the conference guide, because a conference is built around a specific topic for special target audience for a very special purpose. So if you know them well and understand it, it is so easy for you to decide what to write. But when you write a manuscript write an abstract for a conference, you start with picking up any data from any point, but your research question must be aligned with the conference themes. But when you are writing an abstract for a manuscript, you are actually writing it after you complete your manuscript and then you write an abstract. So you have to go through a longer journey. But as I said, an abstract writing for a conference may be the start point of writing a big manuscript. So when you write an abstract for a conference, it should be an independent summary. A lot of people think that an abstract is the summary of the entire research, which is not true. You can pick up any component of your research and just focus on that for writing an abstract, as long as you can find a key focus or new evidence or interesting evidence from your research. So this is a stand-alone summary of your research. It doesn't matter how big it is. Usually it is limited to limited words. I have not seen generally an abstract is more than 300 words, but there are exceptions. But these there must be a rationale covered by short description of method with a main result. And then conclusion is based on the results to give some information that is extracted from your research. But remember that when you submit an abstract for a conference, what you present must be aligned with the abstract you have submitted earlier. It is true for either oral or a poster presentation. Generally, when you publish an abstract for an abstract book or a manuscript, it looks like this.
Ma'am, yes, ma'am, we can see it now.
Then the question would be how to write an abstract. So you know the theme is there and you know what to write and you have identified your audience, but where to start? Starting writing an abstract is a mini version of your exercise of writing a manuscript. So you cannot get away from the effort that you generally need to give for a manuscript writing. So you have to, your first step would be identifying research question, and that can be explored from your database. Then you have to do explore the analytical plan and run appropriate analysis to get your results. And once you get the results, you need to do some literature review and assess what is the value of the research results or the outcome of your analysis that you are seeing in your research. And then you can run more analysis based on your database and find a focus or interesting question that can be presentable in an audience. And then you need to align it. You design an objective and research question, you just align that with your results, and then try to do some literature review and interpret the results, how this can be recommended for writing an abstract. But when you start writing, you just cannot start in an abstract way. You must follow a structured guideline. And this guideline is IMRAT. And you all know about this, I think this abbreviation, many of you. So it is introduction, method, results, and discussions. So this is a very common way of writing an abstract. And I want to go through this to help you how to develop it. But when you write an abstract, if you go by IMRAT, you'll be lost. You need to follow RIMI. RIMI, who is this? A she or a he? RIMI is nothing but some flipping of the alphabets. So you need to start the results. First, find out what are your results coming out of your analysis, and interpret the results, and then find the focus. And then you write the method around it, and then you write an introduction. But when you do that, the first point would be writing a result. So how to do it? So for example, you have not started analysis of a research, or you're writing a manuscript, but you don't know what you can present in the conference. So I'm showing an example of a survey questionnaire of the study done by our groups in icddr. So we have identified that this is about assessing the burden and risk factor of diabetic retinopathy among diabetic patients in outpatient department of hospitals in Bangladesh. And we have identified that the survey 2 included 11 sections. Then it is easy to pick up one of the sections and then try to build an abstract around it. It can be any. It can be some kind of characteristic, some kind of tools used, or some kind of disease spectrum. But since the focus of the study was burden and risk factor, and it is not published, it better be a key focus of the abstract. But when you write the result, you first need to complete the analysis and decide, as I say. But you may need to do this in a multiple way and work as in a team, not independently, work as a team. It is an iterative process. And whatever the results you come up with, you must explore that whether you are really answering the question, the research question that is built into the objective of your abstract. So as I said before, you need to put a high-level outline under IMRAT and put small sentences under bullets that you can expand later. In these bullet words or sentences are the key messages that coming out under each of the sections: introduction, method, results, and discussion. And once you identify the key bullets and you are comfortable with the key bullets, yes, it tells a story and it is linked to each other, then you start writing small paragraphs and write in a very simple and direct manner. So when you write an introduction, and you write the introduction at the end when you see the results, and as I said, RIMI. So introduction comes first. But in the introduction for writing an abstract, we generally try to give a broader statement of the problem, and then we talk about what is the objective of the research you have done. But if your word limit allows you, or some conferences or journals allow you to write longer abstracts, you can also talk about the gaps that exist in the literature and what you are trying to do in order to fill in the gap. But whatever you do, either a manuscript or an abstract writing, you must read the latest and recently published literatures. Otherwise, you will come up with all the efforts with a product that is not sellable, and you really want to sell it to the audience who will be sitting in a forum to listen to you. So once you find your focus and strong justification, then you are ready. But without that, you have to rethink whether you want to start or you want to go over the process again. In any manuscript component of not a manuscript, when you write a manuscript, it starts with title, the author affiliation and the presenters, and who is the corresponding author. So this is some kind of commonality with an abstract as well, and you're very familiar with it. But the title of an abstract or a manuscript is a very important section. A lot of us don't value that, but the title actually speaks the entire picture of your manuscript or an abstract. So it should be very specific, not too vague, too broad, or too general. And you need to be direct, such as what you were doing in a research or the results. We generally like the result or outcome reflected in the title. I'm not going to that, but you probably have done this exercise many times before, but I'm here just to remind you. But the body of an abstract is the most important part that is read for by the readers for any form of writing. An abstract must tell a story, a short story of a big saga of your research. My apology, somebody has been unmute and I'm hearing noise. Maybe this is in my team in icddr, or I don't know. So whoever is hosting, I would request that you mute the person who mistakenly has unmuted the microphone. So I'm reminding you of these slides that you need to go through this structure. But the question is, what should go in the introduction? You don't need to give a very big introduction. It is a simple statement of the problem or a gap, and it's basically talk about what is the objective of your research. And you need to keep in mind that your objective, the research, should be aligned with the analysis that you already have done and the results you already have prepared for writing the abstract. So without having relevance, the objective will not be attractive or eligible for publishing in any document, such an abstract book. So next thing comes as a method. A method is very important for writing an abstract. So as much as you present as in the result must be supported in the method section, how you have come up with that result. So you definitely need to mention about the study design, where the study was conducted, who were your research participants. And often we really want to know how they were recruited, from what kind of population, and how you have recruited them. Sometimes we need to present it. We don't have to cover all of them, but it depends on the results and your interpretation in the end. But the outcome parameter, which is the objective of the study, what you're trying to get out of this research is the objective. And your objective is around some outcome parameters. So if you cannot present or do not present how these outcome parameters were assessed, when you present the results, it would be totally flawed, because people will not be able to understand or follow your result, how you came up with this finding. So I'm just giving an example. So talking about the diabetic retinopathy study. So I am giving an example how the basic abstract was written. It talked about, it was a cross-sectional study conducted in outpatient department of 3 hospitals. Patients were screened by physicians for diabetes, history taken, and referred to a clinic where diabetic retinopathy was assessed by fundus camera, and additional information were collected through history for hypertension and other comorbid conditions, blood samples obtained for doing some biological assessment, and sometimes you may also add some analytical tools used in order to reach to your results. So this is depending on what you present, and whatever you present in your result must be covered and supported by the method. So you have to be careful that they two match with each other. And when you come to the result, it is the most thrilling part of an abstract. So people try to read the result first. They read the title and the result, what you got. And definitely in that result section, people would want to know, who did you conduct the research on, and what did you find in the end? And each and every result that you present in an abstract must be based on the outcome assessment presented in the method, and you do not need to report any result that is not covered under the method section. You can present additional result. Of course, you're most encouraged, and we must recommend you do that, as long as those are relevant to support your key focus of the research. and it strengthens your findings. But what is very important for you to remember, whatever the results you present, it must be aligned with your objective and the introduction and the method. So this is again an example. So the same group wrote in an abstract the results about who the participants were in terms of their demographics, and then what was the condition of diabetes they had, and they're very relevant, right? So when you describe a research report, you must describe who the participants were, because if you do the same research in a different group of participants, it may give you a different result. So it is very important to describe the participants. And your final outcome parameters being presented here. I'm showing an example that the prevalence of diabetic retinopathy and their gradings, although these gradings were done, it was not reported in the method, but it's okay to do that in the results. The research team presented that what they found as a regression analysis showed the association of diabetic retinopathy with some parameters of ophthalmic vision or duration diabetes and blah, blah, blah. So I just want to take a moment here and try to let you see the method, what they did in the method section. So it says what information was collected, information, so demographic informations, fundus information, and medical history, and blood results. But when you look at the results, do you think there are relevance? Anybody? Do you think the relevance, or do you think missing? Anybody? Do you think what is missing that is present in the method and not in the result?
Blood parameters.
Louder, please, Lakshmi. Thank you.
The blood parameters, the cholesterol and HbA1c.
Excellent. Excellent. See, the method said that we collected blood. We also assessed comorbidity, but where is the result? It's not here. So anybody else want to pick another flaw? Anything. There is no right and wrong answer. Every answer is the right answer. Please be bold and let me know, because if you can identify the gap, this is great thing that you're following. If you cannot identify the gap, this is my fault that I'm not being able to communicate with you. So no fault with you. It's all my fault. So please be bold. Anybody else? Just another one. There are many. I just want you to pick up randomly, anything. Okay, great. I'm pretty sure you know. Yes.
There was no age. Yeah, I see the age, but I did not find any information related to the elderly or something like that. Age related information.
Okay. I see here a lot of noise. If you are not speaking into the conference, then I would request you to go mute. So let me help you. So the results said, see, this is a point of, I mean, I love teaching this. The results said that fundus camera was used to look at diabetic retinopathy, and there's a result section included that. But the method also says that the group obtained medical history of hypertension, neuropathy, retinopathy, cardiovascular event, blood samples. Even if you stick to that, the results don't have it. So there are some mismatch, right? So you know, so how to review your own abstract and how to improve it. I think this, I could teach something from this for you to remember when you write your own abstract. But you know, conclusion is a very important part. When you write a conclusion in abstract, we call it conclusion. And in the manuscript, it is supported by discussion section. So we have to do another step. But in the abstract writing, you don't need to write a discussion, but you need to do a conclusion. So the conclusion is actually the interpretation, final interpretation of the results. That is the key message coming out of your research. And it must say, what is new here you're presenting? And often we want to know, so what? So you have to answer this question. What is the key message? What is new here? Or what we'll do with this result? So what? What's next? So what next may not be always available, but as much as is available, presented here. So irrespective of the flaws in the result, this abstract showed that reported in the conclusion, the burden is high but patients were not aware of the complications. Fine, this is very important information that people with living with diabetes and their ambulatory patients, it means they have no problem, but they are already suffering from diabetic retinopathy is an irreversible eye complication that lead to blindness, and they are not aware of it. It's a very important information. And it came up with a so what thing, like establishing a routine funded screening for diabetic retinopathy while treating a patient with diabetes in hospital setting may enhance management of diabetes and diabetes. Isn't it beautiful? So what an important policy question that we are looking at. So when you look at the conclusion or writing a conclusion, so you need to choose the key results very intelligently so that you can draw a conclusion based on the results presented in the manuscript. So don't present anything in the conclusion that has not been presented in the result. And you really don't need to do the summary of your own research. You just pick up the most important point that presented in the results. And if you present something, you may not even pick up in the conclusion, that is okay. But you're presenting something in the conclusion, but it was not at all discussed in the results, which is not at all covered in the method. That means it is an unacceptable conclusion. So once you extrapolate the key message, you need to sell it as long as it's obvious, and it should be supported by a result. I want to repeat it. It should be conclusion, should be supported by a result. So those are all 4 steps that you need to do writing an abstract. Now, when you finalize the abstract, you need to do a final check. So definitely you need to look at the result. They are summarized in a corroborative manner that is aligned with the objective. Your results and conclusions are coherently and correctly reflected in the title of the abstract. And you have to follow 6 S's for writing an abstract. So what are the 6 S's? These are the tips for using scientific writing, any kind of scientific writing. But particularly for an abstract of a general conference, you must write simple words. English is not our mother tongue. We may make mistakes very often. So we must use simple words, meaningful words, and write in short sentences. If there are complex sentences, we should avoid it. And if you think there are 2 ideas presented in one sentence, just break it down. So this is a good way of writing an abstract in a very explicit manner and make it a meaningful reading. And the abstract, as I said before, must be written under the high-level outline and structure, such as IMRAD. So this is a common pattern of writing an abstract, and if there is no template given to you, you can use this template easily. But whenever you write it, any section, either introduction or method or result or conclusion, you must look at the sequential presentation of your sentences that is supported by logic, and you move from one sentence to another sentence with a transitional manner. We cannot just bring one idea and suddenly out of the box come up with another idea in a next sentence. That will throw the readers out of your focus. They will not be interested to read your abstract, then all your efforts will be drained, right? You don't need to do that. So this is really important. You use active voice and directly speak to result. Just don't try to present indirect manner, whatever you want to state. Just state it, write it the way you want to state it. And it's really important, such as specifically mention if it is possible, to qualify by numbers, such as example, when you do, say for example, in the results, I have seen that this group was more knowledgeable than other groups. These groups had significantly different productivity or quality of life than other groups. So I have seen many people writing abstract in a subjective manner. So it is always good to give the numbers or show the quantitative differences, such as in the conclusion, you may say, okay, pneumonia in children less than 2 years is 3 times higher, the burden of pneumonia is 3 times higher than the children older than 2 years. So that gives a direct impression about the burden or magnitude of the results that you have presented. So the conclusion may say that, not a problem. But this is a practicing issue. So you have to write and someone will read it, and you have to be very brutal to yourself, or you have to be very brutal as a co-author to someone who have put the first draft. So don't worry about it. If you work in a team, there are multiple discipline people coming from multiple disciplines, you will get better perspective and you can write a better abstract. And I highly encourage you to write an abstract in a group. So I believe once you follow through all these processes, we'll come up with a beautiful abstract, which can be as good as, how to say it, as good as an abstract that is published in the highest impact journals such as New England Journal. And it is not difficult. You can do that. But for us, we are heading out for an abstract that is for the conference. See, 87 people joined right at this moment. It is a great pleasure. And now I'm going to stop my sharing of the slides, and I'm very happy to hear your perspective, your opinion, your comments, or any questions. Thank you very much.